then you can consider removing it actually. But
good morning, guys. Today is a very special day for me. I have an appointment with my gastroenterologist. Monday, I celebrated 1 year with no hospitalizations. 1 year with no hospitalizations. That's amazing milestone for me. That's amazing accomplishment for me. At one point in time, I will be home for between 12 and 14 hours before going back, and then maybe 1 week, 2 weeks, 3 weeks, and I push it to 2 months, 3 months. Now I'm counting years. God is great. God is good. He's that guy. Today is Wednesday, September 11th. I will be recording the interview with my doctor. My heart and prayers go out to all the families and victims that were lost during the 9/11 tragedy. For breakfast, I made 2 boiled eggs. They're cooling off right now. I'm going to go finish getting ready and I will be back. So my doctor is located in Fort Washington Heights. She's at Columbia Presbyterian. My mom found her one night. I was crying up, vomiting, and she was tired of seeing me suffer, so she Googled gastroparesis specialist in New York, and my current gastroenterologist popped up, and she is absolutely amazing. I had an appointment with her back in, I think, March, but it was so much traffic that I missed it, and now there was no other slot open until today. I can only imagine the traffic that is going to be going up there. I was in 5th grade when September 11th happened. It was just crazy. The hell are they right mind to do something like that's not normal? That's scary. On Saturday, I will be hosting a clothing drive for the victims in the Bahamas. So I'm excited about that. I think I'm gonna do next Saturday and Sunday and drop it off. So I'm in the office waiting for my doctor. Well, I just got my weight and blood pressure checked. Everything's fine. And then I'm going to go in the room and meet with my doctor. While I was waiting, I met another T1D. He did his blood sugar and he was upset with his number. And then I seen him pull out his pen and give himself some insulin. And then we started a conversation. He is also fighting pancreatic cancer. So when they removed his pancreas, they left a little teeny piece. And that's when he became a T1D. He was a type 2 before. And then after the surgery, he became insulin dependent. And I was telling him about the Omnipod, the ups and downs. He takes his Lantus in the morning. And I told him I've done that, and then I switched it at nighttime, and then my numbers were much better. But overall, I do love the Omnipod. I forget I wear it sometimes. I'm not sure if my doctor will want me to record her face in the video. First question is, what would you tell someone who just learned that they have or a loved one has a gastroparesis?
I would say first off to not worry, because there are treatments available and there is research for new treatments. It can be a very difficult, challenging diagnosis, as you know now, but there are many medications that can be used. There's dietary changes that can be used. There's some procedures that can be used that can help manage the symptoms. It is usually a chronic condition that doesn't go away spontaneously, although in rare cases, yes. Okay. But it is something that can be managed.
My next question is, can a person live or mostly a normal life or that is diagnosed with gastroparesis?
As you know, yes, you can. Now, that being said, there's a big spectrum. So gastroparesis severity can be like very, very, very mild, where someone just has to kind of watch what they eat and that's it, to just, okay, I need some medications, to, okay, you need some procedures. The worst, there are patients who have a very severe gastroparesis and they need a feeding tube because they can't eat, or and so it's a big spectrum.
Yes, and I'm a firm believer that they can and will get through it. I went from TPN, feeding tubes, and I'm doing amazing.
Right.
And my next question is, what are the top 3 to 5 tips for someone looking to normalize their life once they learn of their gastroparesis?
That's a good question. I think the most important thing is going to be a lot of planning, because I think probably the biggest change is going to be, well, why can't I just go out and eat whatever I want with a restaurant, with my friends? And I think planning ahead, trying and talking to the doctor, nutritionist, everyone who can help patients with gastroparesis to plan kind of what meals might be a little easier, so you're not stressed about what am I going to eat when I get there. So I think that's the number one tip, is to be organized. Number two, stay in close contact with your gastroenterologist, but all the other people who help too, like the nutritionists and the surgeons sometimes, and social workers, all the people who can be involved in the care depending on how severe the case is.
Yes, and when my mom said we were gonna go out, well, I'm like, let me know the restaurant so I can look at the menu, and then
that leads to my third tip, which is be organized, but don't over obsess about it either. Because I have seen many patients where they get so obsessed with what they can and can't eat, that becomes a whole other restriction on their life. So it's good to plan, but also to try to enjoy things as much as possible too.
Yes.
Yeah.
Next question is, are surgeries that could help with a person's digestive system, including the pacemaker, what are the other procedures?
So the surgical procedures that have been studied are the pacemaker, which is called gastric stimulator, feeding tubes. Obviously that's really more for nutrition, but some people use them to vent, to kind of relieve the nausea. There's something called GPOEM, which is gastric peroral endoscopic myotomy. Not it surgically, not. But the GPOEM is done with an endoscopy, but it's cutting the muscle of the pylorus to kind of keep it open.
And the Botox that comes to...
Exactly. So Botox does similar idea, but the Botox is temporary. It doesn't last forever. And then some people have done the surgery for the pylorus, but now that we have a less invasive technique, the endoscopic method, the GPOEM, more people are choosing GPOEM, obviously, because it's less invasive.
Have anyone ever had their stomach removed because of gastroparesis?
Yes, but in very, very, very rare cases, because the evidence isn't great. It doesn't necessarily always help, and living without a stomach comes with its own issues. Rarely, there's maybe a few studies finding this is really for people who are very overweight as well, who have gastroparesis and who are very overweight, that doing bariatric surgery can help, because you're kind of getting rid of most of the stomach anyway, meaning like gastric bypass or sleeve. But that's very rare that we do that.
Because everything comes with complications. I feel like if they cure diabetes, it's going to come with a complication, and the same with gastroparesis. But if it's controlled and managed, you can live your life. Just take your insulin, do your blood sugar, and the proper medication for the gastroparesis. Does a person need to adjust to a pacemaker for the stomach to get things in control?
Well, it is a surgery, so obviously there's the adjustment of the surgery. Usually what would happen is you get it implanted, you get it turned on, and then you kind of watch your symptoms and see how they are. If it doesn't really help, you can go back to the surgeon or the GI and kind of increase the settings to make it stimulate more. So that would be the adjustments. It's every, you would do that every few weeks probably until you find a setting that works. Sometimes, unfortunately, you don't find a setting that works, which is what you experienced.
Yeah, after I received the pacemaker, I was in the hospital for a whole month. I was still adapting to it. And then when I was released, the following week I was back in, so we had to figure out the setting. I believe my setting is on 7 now, and when I go see him, don't touch it, don't change it. But he said the only way I'll know when the battery is dead is maybe when I have symptoms or flare up. So that's the only way. So I'm hoping it lasts another 5 years.
Well, there's also a chance that the medications are working for you so well that yes, the stimulator's on, but maybe the most benefit is from the medication. Again, hard to know unless we turn it off. One day if you check it and if you see that the battery's dead, then we know that you were well controlled even without the stimulator now, and then you can consider removing it actually. But the stimulator is tough because the best evidence is in someone who has diabetes, but there are many people who have gastroparesis not with diabetes, and it probably doesn't work as well for those patients.
Okay, and I also keep a positive attitude, and my surroundings, I avoid as much negativity as possible, because I notice in certain environments, the negativity, I get nauseous, and then I'm like, okay, I can't be in this environment. And
there's a big brain-gut connection, and I tell people there's a reason we say butterflies in the stomach. When you're nervous and you feel butterflies in your stomach, you're already showing how there's a connection with your brain and your gut. So it might not make your gastroparesis like worse, but you might feel worse when you're nervous or anxious or stressed. So
okay, so it all makes sense. And I also, my nonprofit then might call it the Fearless Butterfly. That's my name. Growth, and I'm still like in the caterpillar stage. I'm still learning, and it feels good. And I just want to share my story and show others that it is possible. You just have to trust your gut, follow your foods, and do what's right.
Yeah, and find a good doctor.
Yes, wow. It's going on what, 2 years? 3 years?
Almost 3, I would say. You had surgery in 2016.
Yes.
3 years ago, they put the pacemaker.
And I think the following year I met you.
Yes.
Yes, okay.
Oh, you're saying with me. Okay,
yes.
Hold on, let me look. August 2017, almost to the day, 2 years.
Wow.
Yeah.
And as soon as you see me, it was like, I know what you need.
Yeah.
Don't bear it home.
Well, I got a little lucky. I'm not gonna pretend I have a crystal ball. Sometimes you just have to find the right, tweak things here and there, and then you find the right one that works.
Yes.
And I had a good feeling, but I also was a little lucky that it worked for you.
Thank you, and I appreciate you so much.
No problem.
So much. So I am back home. I got an amazing report from my doctor. Ma, I gotta tell you something about the doctor.
What? You should have told me something on the phone.
What on the phone with? She's not gonna like what I gotta tell her. He pulling the Calias on us.
She leaving? Where's she going?
She said Ohio.
What? When?
My last appointment is March 11th, and then
Is she gonna be out?
Yeah.
Oh God! So is she recommending you to somebody?
No, I'm lying.
She's kicking your fucking back. Oh, stupid. Wait.
I got you. A funny family. We're gonna start doing family vlogs. I'm gonna do a sibling tag, a mommy tag. So I asked her some questions for you guys, and I'm going to edit the video, then upload it either for tomorrow morning or Friday morning. Again, my heart and prayers go out to all the family members and victims that were lost during the 9/11 tragedy. And also, I will continue to pray for the victims in the Bahamas. Bye, guys. Mwah.